All right, so with that, let me turn it over to Amy. She needs no introduction. We're familiar with her every week. So Amy's going to give us an update as of today. Amy.
Thanks, Kevin. Good morning, everybody. I'm glad to see you all virtually. So we're going to devote the next about 40 minutes talking about COVID. Happy to talk about any issues that are of interest to you. And we're going to have some polls, and we have the results from when we ran this a similar webinar back at the end of August. We have the results from August, and we'll compare the results to the degree that we're asking the same questions. We'll compare those results to now and see to what extent anything has changed. You know, we've been talking about coming back to the physical workplace for a really long time now. We first started talking about it last year, even before there were vaccines. We started talking about, can we come back with masks? Can we come back with physical distancing? And then, of course, when the vaccine started, we thought with gusto, we would all be back in the office sooner rather than later. And then the Delta variant took hold. And so the question now is, and I know when I talk to members, sort of as the small talk in many of my calls is, what are you guys doing? You know, are you back in the office? Are you home? Are you hybrid? Are you back in the office? Is everybody back in the office? And it varies. You know, obviously our manufacturing members, many of you have been at work the whole time physically in the workplace, but to the extent that you have white collar workers who can do their jobs from anywhere, you know, are people coming back? And I think this was sort of highlighted by PwC making a recent announcement saying that they would allow workers to work principally from home, and that all that really mattered is that the employees were within some proximate distance of a PwC office so that they could come into the office up to 3 times a month. One of the interesting things about that announcement was that there would be a cost of living adjustment, at least downward, I assume upward as well. My first question was, if I move to Hawaii, can I get a cost of living increase to live and work there? But they were saying, you know, if you currently live in New York and now you're going to move to Montana, your pay would potentially go down depending on the scales that they use. But basically they're saying you can principally work from home. And my understanding is that is largely a recruiting and retention issue. They are losing people in droves to some of the more progressive tech companies. And so they're trying they're going to see how it works basically, and probably reevaluate in 6 months or a year to see how it's going. But hopefully that is something that will allow them to attract and retain workers. Then we've seen something similar from a lot of the tech companies. Facebook, Twitter, and Slack are 3 that I've saw recently. They're making similar type of announcements. You can work principally from home. We've also seen other large employers doing a total hybrid work model. You see who I have listed there, some really familiar names. That's usually 2 or 3 days a week, either at home or in the office, and vice versa. And I think that the HR concerns remain, you know, on the issues of productivity, engagement, and culture. What effect does it have on your culture that your people are not seeing each other in person on any kind of a regular basis? How does it impact your most junior workers or your new workers, people who need to get up to speed, people who need to get trained, people who need to understand your culture? How does it affect them? I mean, I think of myself as a junior attorney working in a law firm. If I had started working principally from home, how would I have ever asked, you know, all the really stupid questions that you need to ask in the first couple of years, you know, to get your answers, your questions answered, to know how to do the very most basic of things. It's a lot easier to walk down the hall to somebody's office, I think, than it is to make a phone call, to get on a Zoom, to ask in Teams. So I think that the questions really remain on all of those issues. I think a lot of people do like working from home. It's pretty clear. People, you know, gas prices are I just had someone say it to me today, gas prices are so high, I don't want to drive to the office anymore. And we save that commute time for people who have a significant commute. You can be so much more productive in that sense, because you're not spending your time driving. So it really, those questions remain with regard to the HR and employee relations issues. There are also a lot of legal questions, right? What laws apply? I've talked to a number of employers who said, well, we've decided now that you can work from anywhere. So what does that mean? We're based in Pennsylvania. Now we've got employees working from home in Delaware, Pennsylvania, and New Jersey, and we've just hired someone in Colorado. So what does that mean? Know that if the person is principally working from home and that state is not the same state in which you are headquartered, the laws of that new state are going to apply. So you need to think of that in terms of taxes. Obviously not my area of expertise. You need to think of that in terms of all the potential laws that may go with that, the leave laws, the sick leave, the family leave. Are there equal pay type laws that you need to be aware of? So think about that when you're thinking about hiring somebody from a state that you really know nothing about. And there are also potentially immigration type issues. You can work from anywhere. So, okay, so can I work from Barbados? Can I work from Europe? How might that work? So all things that we don't have answers to right now, but all things to be thinking about if you're going to be in that work from anywhere culture.
Amy, before you jump on to the next slide, somebody chatted in that Amazon just announced they're changing their plans. They were going to come back in January. They just said that they're going to go for a more flexible approach driven by the director decisions.
Yeah.
It does seem like they're saying that there's you have to be close enough to your core team, which I think we're going to see a lot of companies kind of saying there's not a required weekly program, but there's going to be a couple times a month that you're expected to be with your team in some fashion or another. So there's something to think about.
Yeah, I think that's probably right. So we actually did have a poll question for here. I don't know, Ben, if we can pull that up. Just curious as to what other folks are doing. For your employees who are able to work remotely, are they working remotely, working predominantly from the office, or hybrid? You can vote right on your screen and be curious to see what that says. All right. Wow, that's quite a split, almost even across the board. So we've got 24% working primarily remotely, 34% working primarily from the office, and 42% who are hybrid. So very interesting. I think every company is trying to make the right decision. Every employer is trying to decide what works for them. So, and every situation is different. All right. So let's sort of move on to the next topic, which is masks. Okay. This one has changed a lot too, because what we saw, all the excitement back in May around vaccines was that if you're vaccinated, you don't have to wear a mask anymore. Well, not so fast. CDC changed that guidance. They said, even if you're fully vaccinated, indoors, you should wear a mask in areas of higher substantial community transmission. And, plot twist, that's everywhere, or just about everywhere, unless you're in a very rural county. Of course, unvaccinated individuals should mask indoors, regardless of what's going on in your area with regard to community transmission. And some locations have gone a step further. We see this in Philadelphia, for example, for institutions that do not require everyone who enters to be vaccinated, everyone on site's wearing a mask. So what should you be thinking about as you develop a masking policy? I mean, these are sort of and again, this is a little bit up to you. I think one of the great challenges that we have right now is, a year ago when there were all these you have to's, right? Things being mandated by the state. It was a little bit easier. We didn't necessarily like what the state was telling us to do, but at least we knew what to do, right? The state would say, do X, we did X. Now the state is saying, and the CDC are saying, you can kind of decide for yourself. And I think that's where it gets complicated. So you have the CDC guidance, and you're safest following CDC guidance when it comes to health and safety issues. And we as employers have an obligation to provide a safe workplace under OSHA. But, sort of what's going on in your workplace and what works best for you. So should everybody be masked or just the unvaccinated employees? Should it be in all spaces or just public spaces? Even when we had a mask mandate in place in Pennsylvania, the guidance was if you were in a private office by yourself, you didn't have to wear a mask. So, what does your workplace look like? Are you in a very large warehouse where people hardly come into contact with each other? Or are you in cubicles that are, kind of all mashed together? It depends. Should masks be mandatory or voluntary? What are you going to do for visitors? My thought is whatever you do for your employees, you should be doing for visitors too. If your employees are masked, your visitors should be masked. But even, some visitors may want to wear a mask. And of course, you're never going to tell someone you can't wear a mask if that's what they choose to do. So again, you think about your density. How easy is it to socially distance? How much interaction do your employees have with the public? What percentage of your workplace is vaccinated? We'll talk about that more. I think it does matter. We've seen this in professional sports. There are different guidelines if you get to a certain level of vaccination in your team, and that's not just the players, that's the people who are around the team, the coaches, the trainers, et cetera. In a lot of the professional sports, it's 85%. If you can get to 85% vaccinated, you get special privileges. So you think about that in your workplace. If I know that I have 100 employees and 85 of them are vaccinated, I can feel a little bit better probably about relaxing some things than I can if I only know that 30 of my folks are vaccinated. And we'll talk about getting proof of vaccination. We've talked about that before, but I'm going to reiterate it again, that I think it's a good idea. I think it's a good idea to know what you're working with. And are you going to require regular testing? And we'll talk a little bit more about testing as well. But Ben, I think we have another poll here, and we can compare these results to the results that we had back in August with regard to masking. So are you requiring masks in the workplace? Yes, for everyone. Yes, just for employees. Yes, for unvaccinated only. No, or we really still haven't decided. All right, so the largest percentage here is yes for everyone, including visitors at 37%. Next is no, 26%, not for anyone. Then 22% yes for unvaccinated individuals only, and 11% for employees only. And we have a small percentage who still haven't made a decision on this. So I wonder is there a way that we can look at these? I don't know if we can look at them side by side, but can we sort of compare that to what we have going on now? Oh yeah. All right, so I can see that at least if you guys can't. So back in August, it was yes for employees only, was only 7%. Yes for everyone, including visitors, was only 39% as opposed to 37% here. Okay, so that hasn't changed that much. Yes for unvaccinated individuals only, again, that has not changed that much. So interesting, not a huge change from what we saw back in August. All right. So one of the next questions is, and again, this is one of those, Kevin, do we have questions?
A couple comments that just came in that related to this was somebody mentioned that their local food market had allowed vaccinated to work without a mask. Now they're providing $1 extra so it's customer facing that voluntarily wear a mask. Again, I don't think that's necessary to incentivize people.
Yeah.
Someone else mentioned that there are breakthrough cases occurring, which leads to probably something we'll talk about later in terms of boosters as they come due and kind of how long the vaccines work. So.
Yeah, and I think one of the things to remember about masks is primarily, depending on the type of mask you wear, but if it's not a medical grade mask, primarily if my mask protects people from me. So that's one of the things to remember. So the idea behind having your employees wear masks, that's great because now you're protecting your public from your employees, but you're not protecting your employees from the public so much. So, and the thing about your employees is you have an opportunity to know who's vaccinated and who's not, as opposed to the people who are coming in from the public. So it is an interesting question as to where we go. I mean, the good news, at least in the area that we live in, is we do have a relatively high vaccination rate as opposed to many other areas of the country. So that is helpful at least. All right, so let's talk about travel a little bit. We were in this, I think it was about a year ago when Pennsylvania and some of the other Northeast mid-Atlantic states put in those travel restrictions. And we were telling employers, you may want to track employee travel and decide, to impose these quarantines when people come back. So the question is, what do you do now? Well, of course, if it's business travel, you want to follow CDC guidance. But what about if it's personal travel? Do you really want to be tracking all of your employees' personal travel? Do you want to be asking people to not come in the office? Do you want to be asking people to test? Just all things to be thinking about. Again, it's not a have to, it's a maybe you want to. These are the current CDC guidelines. For vaccinated travelers, you need a negative, if you're traveling internationally, you do need a negative test to return to the US, get tested with a viral test 3 to 5 days after travel, and then self-monitor for symptoms. And obviously, if you develop symptoms, you isolate. Unvaccinated travelers, a little bit different, negative test to return to the US, get tested with a viral test for 3 to 5 days after travel, and stay home and self-quarantine for 7 days after travel, even with a negative test. And if you don't test at all, stay home for that period of time. And then domestic travel, again, a little bit different between vaccinated and unvaccinated. For vaccinated, we're saying just self-monitor, and if your symptoms develop, obviously you go into COVID protocol. But unvaccinated, you should test and stay home and quarantine. And if no test, stay home and self-quarantine for 10 days. So again, is this something you as an employer want to be tracking among your employees? Your health and safety obligations, if you follow everything that CDC says, it's hard to question your health and safety protocols, but some of this can get burdensome and can become administratively difficult. So you need to decide. But if you are going to implement something like this, the other thing that I would suggest is, what are the consequences for employees who lie to you? It's an unfortunate reality that employees lie to us. And so, for example, if you have an employee who says, yeah, we're going to the Poconos for a couple of days, and then you see somebody sees on Facebook that they actually went to Disney, what do you do about that? Or they went to Mexico, what do you do about that? Is there punishment for somebody who lies to you if you're going to have these protocols in place? Just all things to be thinking about. All right, so let's talk vaccines. You guys have seen this slide. If you've been following these webinars, you've seen this slide probably, I don't know, a couple dozen times already. But I like to include it because I think it gives us all the same base of knowledge. And I recognize the fact that there are some new people on every week. So yes, you can require the vaccine, at least most places you can. Governor in Texas came out in the past couple of days and said that employers in his state cannot mandate the vaccine, setting up a showdown between Texas and the federal government, obviously with the mandates that are coming from the federal government. Keep in mind that you have to allow for reasonable accommodation, an interactive process on the basis of disability and or religion. I'm going to talk more about that in a few minutes. The lawsuits so far have gone in favor of employers. You want to have a legitimate health and safety reason for this. So if all of your employees are working from home, putting aside government mandates, if all of your employees are working from home, you probably are not mandating the vaccine. But if people are coming to work every day, especially if they're dealing with the public, you probably do want to at least be thinking about mandating vaccines. And obviously, we now have full FDA approval of the Pfizer vaccine, which I think helped with some people who were hesitant before, who said, oh, this is an experimental drug, and we really don't know anything about it. And you guys have heard me talk about carrot and stick approaches all along. So we've got a couple of things going on. We've got the federal government employees. I'm not really going to talk about that because our membership at MEA is almost exclusively private employers. But some of you are government contractors, and we've gotten a number of questions on Hotline about sort of where that lies and what you should be doing. It's kind of an interesting catch-22 when you talk about federal contractors, because keep in mind, you have your current contract with the federal government. The federal government is not coming in and changing that contract. So the vaccination requirement will go in when you sign a new contract, you renew or extend your current contract. That's when the vaccination language will go in there. The problem is that based on everything that I'm reading, the vaccination language is still going to say, no matter when you sign that contract, that your employees needed to have been fully vaccinated by December 8th of 2021. So on the one hand, you could say, oh, I'll just wait until I sign a new contract with the government because that's when the language will go in there. But unfortunately, it might be a retroactive requirement. So it is something to be thinking about now. We've had a number of questions from contractors, does this apply to me? Am I the type of federal contract that this applies to? There are attorneys out there who specialize in federal contractor law. And so if you really do have a question, I suggest that we can help connect you with somebody who can help you. But generally speaking, if you were affected by the minimum wage executive order that came out a few years ago with regard to federal contractors, you are affected by this. It's basically the same categories of folks who are affected by both. So, and keep in mind, that the vaccination requirement for federal contractors does include remote workers as well as workers who are on site. It also includes a masking and a physical distancing requirement. It also requires the federal contractors to verify vaccination status by collecting cards. You do not have to collect cards for visitors, but visitors are being asked to sign attestations. Visitors to federal government offices are being asked to sign attestations saying that they are or vaccinated or have proof of a negative test. So keep all of that in mind. With regard to the 100 employee requirement, we're still waiting on OSHA. We're going to get an emergency temporary standard, ETS, hopefully coming sooner rather than later, that will answer all your questions. We've gotten a number of questions on this on hotline. And unfortunately, as I keep saying, I've never said I don't know more in my legal career in the last 18 months than I have, the whole time. But we just don't know a lot of these questions yet. One of the questions is, how do we get to 100 employees? How do we count that? Is it one office? Is it multiple offices? Is it people who work outside the US? My guess is the federal government's going to be as inclusive as possible and make it count everybody. The other question is, who will pay for the testing? The indication is that the ETS is going to address this. So stay tuned on that, because this could get very expensive very quickly for employers or employees, whoever has to pay for the testing. And there have been multiple legal challenges filed to challenge these government mandates. So kind of stay tuned on that to see what happens with that as well. At the same time, we're seeing private employers just step in and start doing the mandates themselves. We're seeing it in tech, we're seeing it in big pharma, we're seeing it on Wall Street, we're seeing it in transportation. We're seeing more and more new job postings list vaccination as a requirement. And that is something to keep in mind. If you're going to have vaccination as a requirement, maybe for some of your jobs, think about what your job descriptions look like. Make sure you have the good reasons in there. This is a client-facing position, the person has to travel, et cetera, and are you going to actually put the vaccine is required as part of that job description. And we have gotten a lot of questions on the hotline with regard to what Delta did with their healthcare surcharge. If this is something that you're thinking about doing, there are HIPAA implications, there are Affordable Care Act implications. Definitely discuss this with your carrier and definitely discuss this with a benefits attorney. All right. Why don't we ask the vaccination question now? Put that poll up, Ben, before I move on. Are you requiring your employees to be vaccinated? Yes, no, or undecided? All right, so far it's 67% saying no, 15% saying yes, and 19% saying undecided. And that, I'm wondering if we have the, yeah, okay. I did it a little bit earlier this time than we did it last time. So back in August when we did this, we had 81% saying no, as opposed to 67% saying yes, no now. Only 8% said yes back in August. Now we've got 15% saying yes. 11% were undecided back in August, and 19% are undecided now. So interesting that the number of folks mandating vaccines has definitely gone up. But let me move back. Another question we're getting a lot about is, what about medical and religious exemptions? And we are working on, we think, a standalone webinar to talk about this issue as well, because it's hard to put into just a couple of minutes. But keep in mind that just because someone requests an exemption for medical purposes or religious purposes, that's not an automatic out for them. That doesn't mean you just say, okay, you don't have to get the vaccine and you can keep working as you were working before. You are supposed to go through an interactive process. And actually, if you don't go through an interactive process under the Americans with Disabilities Act for medical reasons, you violate the ADA by not going through that interactive process. So you want to exchange information. A lot of employers are using forms. Explain to me what your religious reason is, explain to me your medical reason. If the medical reason is not obvious, and my guess is it won't be obvious in many of these cases, people have underlying medical conditions, the reason that they can't get the vaccine. Maybe they had an allergic reaction to the first dose, so they're not getting the second dose. You can ask for medical information as a backup for that. And just because the person has a valid medical reason, or just because the person has what appears to be a valid religious reason, again, doesn't mean that it's an automatic go. Doesn't mean automatically that you say you don't have to get the vaccine. You can think about, are there alternatives? Does this person work from home? Does this person wear a mask? Does this person socially distance? And you ultimately can make the decision that it's an undue burden on the employer to grant the exemption, or in the case of a medical situation, that the employee poses a direct threat to other employees in the workplace, to themselves in the workplace, to the public in the workplace. So it's not, every situation should be handled individually. My recommendation is that you have probably not just one person. I was talking to a member recently. They've created a panel. They've mandated the vaccine, and they have a panel of, I think, 3 people who are going to decide all the exemption cases. And that it helps you, first of all, be balanced if you have more than one person making the decision, but it also helps with consistency if you have the same people making the decision every time. So things to be thinking about if you are mandating and you have to talk about potential exemptions. So if you are in that category where you think that vaccine mandate is coming down the pike, you've got more than 100 employees, or your healthcare, or your any of those mandates that are coming, you're a federal contractor. So decide first if you think you might be affected by the mandate. Again, determine what percentage of your employee population is vaccinated, and to develop a communication plan with your employees. Your employees read the news, they know what's going on. Let them know that you know that there are concerns, that you're thinking about it and you're deciding what to do. Again, you can ask employees if they've been vaccinated. I think you should. Under the Americans with Disabilities Act, you're allowed to ask, are you vaccinated? You're not allowed to ask the follow-up question, which is the why or the why not, because that could be a medical inquiry that is prohibited by ADA. Keep in mind that this is considered a medical record. It should be kept confidential, separate medical file. Now, there are some places where you may not be able to ask. Some states are passing all sorts of restrictions on employers as to what they can ask. So, but anywhere in the Northeast, you're fine. You can ask the question. Again, maintain that record separately. But I do think it's a good idea to know what you're dealing with. And there are lawsuits going on both sides of this. There are employees who are challenging the vaccine mandates on the one hand, and then on the other hand, I just read this morning about there was a PAC that was created in Wisconsin, and their primary goal is to sue school districts who have not implemented safety restrictions. When the students have contracted COVID, and they're blaming the school, and they can reasonably link it to the school system, they are now suing the school systems for not putting in place significant or sufficient safety measures. They're not masking, they're not physical distancing, they're not doing all the things that they're supposed to be doing, according to CDC guidance. And so there are both sides of this, and that should be interesting. Like I've told you guys, I said this back in March of 2020, the lawsuits will come. And I've got a slide on that too. One of the first lawsuits coming from the EEOC. Lawsuits are definitely coming. You really need to think about what side of this you want to be on, where your priorities lie as an organization, the legal issues versus the business issues versus the employee relations issues, and how all of that plays out. All right. So, Kevin, before I move on, do we have questions about vaccination?
Well, we have a lot of questions. You want to take a minute to go through some of these? They're
Sure.
not all kind of in the same vein. Are you going to cover FFRCA later? Because that's one of the good questions.
I do have that in my in my
hold
presentation. Okay.
Someone just wanted to confirm that they're allowed to tell people that that are not vaccinated they have to wear a mask. There's no discrimination issue.
Yeah. So I think what's sort of interesting is the unvaccinated are not a protected class. We do need to think about the possibility that some of the unvaccinated may have religious issues or medical issues, which could give them protected class protection. But yeah, the unvaccinated are not a protected class. And what I like to say is if we're making a distinction in the workplace that some people have to wear masks and some people don't, the people who are being asked to wear masks or being forced to wear masks are the people who have not given us proof of vaccination. So it's not necessarily the unvaccinated, it's people who have not given us proof of vaccination. And it helps you avoid that distinction a little bit.
Someone, and I don't know the answer to this, someone mentioned that the Pfizer drug is still under the EUA, the emergency use. It was another drug that was approved, but it's not available in U.S. markets. I think I recommend somebody has to go look at the CDC for more, or FDA for more of that. I don't think we're in a position to comment on that. Someone else asked a question: has the CDC said anything about what type of mask is either recommended or required? Because some thought that the virus particles are so small they needed an N95 only, that I don't think they've mandated.
No, they've said pretty much any kind of mask is the one thing that I've heard is that the gaiters are not very effective at all. But remember that you're not trying to keep the microscopic particles from escaping. What you're trying to do is prevent the projection. So it always makes me laugh if I'm out and I see somebody with a mask on and they go to sneeze or they go to cough and they pull the mask down and then they sneeze or cough. That's what you're trying to do. You're trying to keep people from propelling their germs. That's why we do 6 feet of physical distancing. So it really can be any cloth mask. Obviously, multiple layers are better, or the disposable medical masks that you see.
Yeah, and I would say also to look at the type of job, because obviously a healthcare environment wants an N95. If you have employees that are very close with customers all day long, you might want to think about what's the right standard for that.
And there are respiratory issues potentially too, less so now, but sort of when we were dealing with the heat this summer, there were all sorts of issues. If you've got a non-air conditioned facility, you've got employees working in the heat, working with masks, and that's stuff to be thinking about as well.
And back to the government contracting, somebody indicated that the Department of Defense is starting to modify current contracts to include the language about the vaccination.
Oh yeah,
it's
coming.
Seeing in your contracts. Yeah.
Yep.
So I would say look at your contracts. That'll give you some better guidance as well. Someone's asking questions about if we do come up with the mandate goes into effect, the availability of tests around the state and country, and that will be an issue, which again, I think is something that's being considered as part of developing these guidelines, because you can't create a rule that's not able to be implemented. Right. Let's see. Would a recent COVID positive be a temporary medical exemption? I guess back to you, or I don't think so.
I mean, I think what this question gets to is the idea of antibodies. And we've had a lot of questions, can the employee be exempted from the vaccine mandate if they can prove that they had COVID and they have antibodies? And the answer is no. None of these mandates allow for that exemption. The CDC has not said that should be an exemption.
Someone asked a good question. You mentioned about having a panel, which I think is a great idea for exemption requests. Do you have any concerns about the confidentiality requirement with that kind of information?
Well, you need to think about who's on that panel. I'm not just, it's probably, if you have a safety person, it's probably your safety person, and it's probably 1 or 2 people from HR. So people who have confidentiality obligations to begin with. Of course, you want to be limiting medical information. You want to be limiting this type of information. So yeah, you need to think carefully about who's on that panel.
And I did notice there were a couple more questions about federal subcontractor, and Karen Goldman did put links to a couple of good FAQs from the task force. So for those contractors, take a look at those that are there. Thank you, Karen.
Yeah, you beat me, Karen. In the email that's going out after this, I was going to send a link to the FAQs, and they're just like all FAQs. They're okay. They don't answer every question, but they're a little bit helpful. So.
Good. I think that's it. We can move on.
Okay. So let's talk a little bit about testing. Should you be requiring regular testing for your employees? Again, for all employees or just unvaccinated employees? Maybe you do it for travel purposes. Maybe you do it when an employee is going out to a customer site. Obviously, the PCR testing remains the gold standard, although my understanding is that the rapid tests have gotten better as far as their efficacy. Self-testing, I think, they are accurate, But I think there's a lot of potential for user error. Like, are you really collecting the sample in a way that's valid? The question is going to remain, who pays for testing, no matter, and like I said, I hope the ETS, and I think based on what I've heard, the ETS from OSHA is going to address this issue when it comes to federal, or when it comes to the federal mandate of 100 or more employees. But it should be interesting. And who pays for time spent testing? Keep in mind, if you have non-exempt hourly employees, DOL has already come out and said, yeah, you're paying for that time. So think about that as well. All right, so what should you be doing around making sure that your employees who are sick stay home? So we're in a very interesting place right now. As we're out and about more, last year at this time, if you got sick, you probably had a fairly good chance that you had COVID, right? But now we're out and about more. There's less masking going on. Now people are really getting sick again. People are getting colds. People have allergies. People are getting the flu. But you still, as an employer, want to encourage your sick employees to stay home. So what are you doing around that? FFCRA has expired. I know we had a question about that. So that is no longer something you need to be thinking about. There is something in the Biden plan about giving people time off to get vaccinated, paid time off to get vaccinated and to recover from reactions to the vaccine, but there's no longer that paid time off under FFCRA to quarantine or to isolate. So keep that in mind. So what can you do? Do you want to expand your PTO? Are you going to require a negative test to return? Who pays for that test? Who pays for the time to go get tested? Are you going to require a doctor's note to return? Early on in the pandemic, CDC and EEOC were saying, it's a real burden on the healthcare system to require people to get doctor's notes to return. That may be less so now, but it is something to think about. What should we be doing around that? So we do have a poll question as far as what folks are doing around PTO. Or what they're doing to encourage sick employees to stay home. So if we could pull that up. Have you changed your PTO policy to encourage sick or exposed employees to stay home? Yes, no, still thinking about it. All right, 66% say no, we haven't changed our PTO policy, 18% say yes, and 16% are undecided. And I can compare that to what we saw back in August, where it's about the same, except that we have more undecideds now. So 17% said yes back in August, as opposed to 18% now. 77% said no versus 66% back. I'm sorry, 66% say no versus 77% back in August. And then the undecideds have gone up. It was 6% back in August and 16% now. So it is something to think about. What are we doing to make sure that those employees who are actually sick are not coming to work? And I promised you this. And this is just one small example of the lawsuits that are coming. So we've got lawsuits challenging vaccine mandates. We've got lawsuits saying, challenging vaccine mandates, challenging mask mandates on the one side. Then we've got lawsuits saying, you're not doing enough to protect us on the other side, and we're getting COVID. So you've got that sort of coming together. But then you're also getting your regular run-of-the-mill employment lawsuits. So EEOC has brought its first pandemic-related lawsuit against an employer for failing to allow telecommuting as a reasonable accommodation under the ADA. The employer is ISS Facility Services. They're a Denmark-based workplace experience and facility management company. Their headquarters in the US are in San Antonio. They had an employee who had lung disease, made her more susceptible to COVID-19. The employer denied the employee's request to work from home, even though there were other people in her position who were permitted to telecommute. Soon after, the employer terminated the employee for performance. EEOC has now sued that employer. So stay tuned on that. And that was one of the things I talked about kind of early on in the pandemic as far as a challenge for employers, which is we're doing all this telecommuting. It's going to be much harder in the future. Doing all this telecommuting, and it largely works. It's going to be much harder for employers in the future to say telecommuting is not a reasonable accommodation. So we'll see what happens with this one. My guess is, EEOC is usually pretty smart about this stuff. My guess is they picked a case to be their test case that has very good facts for them. But sort of stay tuned. And if I get any information that case is settled, I will certainly pass that along to you. EEOC is always very good about announcing their settlements. So always what topics we'd like to hear in future town halls. But let's take our last couple of minutes, Kevin, and address any other questions that have come through.
So I might have missed so the question, did you address FFRCA? So the question is twofold, and if you've addressed, I apologize. Will it get extended? But I think more importantly, what should people think about for their policy when someone has to either quarantine or is home sick? Because I think a lot of companies have that combined PTO that's vacation and sick, and people don't necessarily want to use their PTO for them.
Yeah. So there's no indication FFCRA is going to get extended. It has expired. Like I said, the Biden plan is contemplating some paid time off to get vaccinated and to recover from the vaccine. But all the stuff we had before about quarantine and isolation and kids being off from school, that looks like it has gone away. Keep in mind, there are a handful of jurisdictions who still have some of that stuff in place, but on a federal level, it looks like that has gone away. And so what should you be thinking about? Yeah, I mean, I don't know that there's any other good alternative than giving your employees more PTO or extra, more in their bucket. And maybe you can earmark it specifically to be used for COVID reasons, although that may induce some employees to be less than honest with you. So you might want to think about the proof around that. But I don't know a good answer to that question other than putting more time in the PTO bucket.
And that type of thing, if you were to do it, I would say make that a temporary policy that you can change at any point so that you can almost create a separate bucket for them.
Agreed.
With whatever proof requirements you're talking, that you think makes sense.
Yep.
Let's see, someone's future topics. There's a couple of things in there. Somebody pointed out that they are paying for the time off if you've been vaccinated and not paying if you were not vaccinated. So kind of so I think you see a lot of what's going on out there is not going all the way to mandates, but making it difficult or financially a hardship if you're not vaccinated is a one approach. So that's an example.
And that's the idea of all these mandates that are coming down the pike. The idea is to make life a lot easier for the people who've been vaccinated, to encourage people to get vaccinated. Anybody who was on the fence, encourage you to hop over the fence and get vaccinated.
And back to the domestic travel, I think your slide referred to recommendations, but they're not currently any CDC requirements.
No, it's just CDC guidance. It's just something to be thinking about. And I think especially if your employees travel for business, it's definitely something to be thinking about.
All right, well, I think that's it. Amy, great job. Covered a lot of topics today. And I think it's always helpful to kind of do this every couple of months to kind of get a whole holistic view. So thank you for that. Thank you for all the great feedback, everybody, in the poll answers. I think with 140 or 50 people on this, I think it's really helpful to see what others are doing. So I appreciate everybody participating. Thank you very much.
All right, everybody have a great week.